Welcome. Welcome to our interview today. Today we have invited two heavy guests to talk about a very important issue with us. That's CVD, patient management, and medication adherence. The two guests are first Professor Ma Changshen, who is head of the cardiology department of Anzhen Hospital, affiliated with Capital Medicine University, and also chairman of the cardiology committee of the China Physician Association. Yes, good afternoon, the moderator and Dr. Freda. Yes, and also we have Madam Dr. Freda Levi's Ho, who is Pfizer Global Chief Medical Officer, who is also a very good moderator of a talk show. Yes, today we are going to discuss a very important question. That's adherence. Adherence sounds like a very technical term. So I think Dr. Freda, you should first explain to us what is adherence.
Adherence is a term that's often used by physicians and other healthcare professionals. And very simply, it means how well patients follow the advice that's given. And this is a very, very important thing, adherence, because following advice, especially in medication taking, is very important, because no matter how good a medicine is, a patient can't get better from it if they're not taking it.
Yes. We know the principles that we need to follow the physician's advice, but still at home, sometimes patients do not fully adhere to the physician's advice. So what is good adherence? What qualifies for adherence? What qualifies for bad adherence? Maybe you could give us some examples.
Yes, so adherence is very important in a range of things. Some patients don't take the medication when they're instructed to do so. They may stop taking it altogether. They also may not follow preventive advice, changes in diet and exercise, smoking, alcohol consumption. These are all things that a physician may provide advice on that a patient that a patient should follow if they want to get better. Now, the good news, or the other side of that, is patients who do adhere and follow physicians' advice generally have better outcomes.
Yes, for the drug itself, I think adherence is also important for the drug to give full play.
Absolutely. So many people don't think about how complex medications are. But if you think about watering a plant, for example, you want to do that regularly, because the plant needs a certain amount of water regularly over time. Watering it too much, stopping watering it at all, or watering too much, all of those things are bad for a plant. So now let's think about a person in medication. You take medication and it's used by your body at a certain rate. In many cases, let's use the example, 12 to 24 hours. So if you take the medication in the morning and at noon, but then don't take the medication for the entirety of the next day, then for that time, your body does not have enough of the medicine in your blood in order to do the work that it's intended to. So it's really important to take the medication regularly in order to get the desired effect. The other way in which people are often not adherent to medicine is that they don't take it at all, or they only take it when they have symptoms, even though it's required to take regularly. So someone with hypertension, for example, may decide to only take the medication when they feel dizziness or some other symptoms, when in order to get the full effect of the medicine, they should take it as instructed by the doctor every day.
Yes, for adherence, it's very important to the management of chronic diseases, especially CVDs. But for such diseases, usually they don't have symptoms. For example, I don't have pains, and so therefore the patients usually will forget. Only when they have symptoms, they will begin to be serious about it. Because these diseases usually do not have symptoms to remind them of the necessity of a medication. So for chronic diseases, adherence is important, but also can be difficult. And I think for CVDs, it's also the same story.
It's exactly the same story. So if you think about the risk factors for cardiovascular disease, many of them are silent. High cholesterol, for example, or high blood pressure, those are silent killers. You often don't know that you have high cholesterol, for example, until you have a first very serious event, like a heart attack or a stroke. So it's very important for people to both screen for these very important risk factors, but also for them to be adherent to the medicine that can prevent a heart attack or a stroke.
Yes. When I talk to patients, we also might use the word adherence, and we will ask the patients, when you go back home, please take medication on a regular basis. I think for Chinese physicians, they will also ask the patients to take medicines when they go back home. But for adherence, then what about the situation in China, Professor Ma? Yes, for adherence, as Dr. Freda has said, it's about following the physician's advice. But usually when I talk to patients, I will tell him, please take medicine on a regular basis. Please keep your good habit of taking medicine. For adherence, most importantly, it's about controlling the disease at the appropriate level. And that's where you should follow the physician's advice, but that's the minimal requirement. Patients should also have their own principles and have their own medical know-how. If you have a blood pressure, definitely you should take medicine. Not only physicians will tell you so. In fact, other sources of knowledge will also tell you so. You even need to be on the lifetime medication. When you go to see a doctor or in the clinical practices, I think as a patient in your day-to-day living, day-to-day life for the next, for example, decades of years, you should, yes, follow the physician advice. You should take medicines as told by the physician. And also for your own health, you also need to change your way of life, including your diet, your physical exercise. You should also follow physician's advice on your lifestyle, not only on medication. You need to do as planned. Yes. But a Chinese saying says all medicines have a toxicology. We know medicines are good for our diseases, but still they have some harms to our body. But which outweighs which one? How to balance the risk vis-a-vis the benefits? Maybe everybody has his or her own judgment. For me, usually I shy away from taking medicine unless I have to. 2 weeks ago, for example, I had a cold. But I didn't take any medicine. I simply drank more orange juices, and also I drank more water, and after that I felt better. So maybe that's my way of responding to the illnesses. But of course, having a cold is quite different from having CVDs. Still, for the patients, how can we educate them even in a better way that medicines are not only necessary, they are even helpful? So how can you persuade me, and how can we persuade the CVD patients and other chronic disease patients to take medicines on a regular and even long-term basis? Yes, I know what you mean. In fact, there are different kinds of diseases. Cold is only a small minor illness. In China, yes, we have our own culture, and the saying is right. All medicines are toxic to some extent. But still, why do we stress the importance of adherence? For some diseases, at least, you cannot do without medication. For example, high blood pressure. If you don't take medicines, then in 10 or 20 years' time, you might suffer from myocardial infarction or even stroke. You will get paralyzed, or even you will lose your life. And therefore, that danger is twice or even 5 times greater than simply having some side effects of the medications for yourself, for your family, and for your social responsibility. As a high blood pressure patient, you have to take medicine. If you don't take high blood pressure medicine, you might even lose your life. And for a high blood pressure patient, if you take medicine appropriately, then definitely you will be healthier than those who refuse to take medicine. If you refuse to take medicine, your risk profile is 5 times or even 6 times higher. And others might have a longevity of 70 or 80 years, but you don't. So if you don't take high blood pressure medicine, your longevity, your healthy status would badly be affected. Yes, Dr. Fred, as I have talked to Professor Ma, that we need to strike a balance between the benefits of a medicine and its toxicology, which is even more serious. For the chronic disease patients, how should they correctly understand adherence?
So let's talk about let's use stroke as an example, because I think it's a very important, and we can give some statistics about stroke. I fully agree with Professor Ma. It is so important for people to understand why they need to take medicine in the first place and why they need to adhere to it. So let's think about people who've never had a stroke but have high blood pressure or high cholesterol or other risk factors for having a stroke. So in many cases, people do not take their medicine properly. Their blood pressure stays high, their cholesterol stays high, and a series of events happen that lead them to have a stroke that could possibly have been prevented if they had followed advice about preventive lifestyle changes and medication. So each year in China, there are about 2.5 million strokes, new at that time, or first-time strokes. About 1.7 million deaths related to those strokes, and a great degree of disability. So about 75% of people who have strokes and live have a very serious complication, like paralysis or some other sequelae. So these things could potentially have been prevented by working on their hypertension, their cholesterol, and being adherent to the advice that they had been given. Now, so now you've had a stroke, you've survived that stroke. All of the work of your family, your caregivers, the healthcare system has worked to reduce your paralysis, to reduce your complications. In many cases, people go home on medication that's designed to lower their blood pressure, to keep their blood flowing more easily, to prevent them from rebleeding, to lower their cholesterol. And again, they're non-adherent. And the consequences of that are also very serious. So non-adherence to these cardioprotective medicines that we were talking about lead to an increased risk in some cases of about 10 to 40% of having to go back into the hospital, and of mortality of between 50 and 80%. And non-adherence to doctors' recommendations or lack of medical intervention can actually increase the risk for further complications or morbidity by between 12 and 25%. So in the first place, you may have been able to prevent a stroke, and then after you've had a stroke, you may be able to prevent the seriousness of your complications or being rehospitalized or even dying if you are adherent to your medication. So this is a very, very serious, a very important issue.
Yes, Professor Ma, as Dr. Fred has given us a lot of numbers. These numbers really are big numbers, and they can all tell us that adherence is very important. Then according to your experience and according to the statistics in China, the situation of non-adherence is even more serious in China? For the past decades, China's economy has made a lot of progress. At the same time, the Chinese eat more food and we have gained weight. The rate of obesity in China is also rising up very rapidly. In the US and in Australia, we don't have so many fat people yet. That's good, but still, I think for CVD's incidence rate in China is climbing up. Moreover, we have a big population. Moreover, for the non-communicable diseases and for infectious diseases, our responses have been better. Our longevity or life expectancy has increased. So the absolute number of patients is rising up. As people have a higher life expectancy, then every year, the CVD resident prevalence rate is increasing.
And we haven't reached a turning point overall in the nation. The incidence rate is increasing and the morbidity rate is increasing even higher. And the good phenomenon is that in China, in the big cities, because of the public education, economic development, the overall trend is improving. In cities like Beijing, Shanghai, Guangzhou, the heart disease bending curve should be controlled, and in the developed countries, and that's another situation. In the future, the cardiovascular disease for the public education, for even the healthy people, our education objective should be that as long as you control it very well, then at least we can prevent it or delay or postpone the onset of the disease. For example, before 60 years old, you will not have MI and stroke. So we should inform the people that they should take the blood and the blood lipid lowering medicine. If you take it regularly, then your lifespan will be improved, your life quality will be improved, and your life quality will be even guaranteed. If you don't take it regularly, the troubles will increase. And through the decades of efforts, the public's knowledge and awareness, and in the big and also in the mid-sized cities, are quite optimistic. However, in the rural areas and in the small cities, which account for half of the population, the heart disease incidence rate is still very high. For example, hypertension in the Western Europe, in the US, 80% of the hypertensive patients know that they have hypertension, and 70 to 80% take drugs, and 50% will reach the standard, and 50% of the population take the drugs to control the hypertension. And in Shanghai, only 20%, and in Beijing, only 20%. Reach the standard. For example, in China, 100 hypertensive patients, only 60 patients know that they have hypertension, and only 30 to 40 patients take drugs. Only 15 patients control their blood pressure to the good standard. However, in Western Europe, in the US, 85 out of 100 know they have hypertension, and also 80 of them take drugs. 50 of them will lower their hypertension to a good level. In China, the average percentage is only 10%. Only 10 out of 100 can control their blood pressure level to very good level, especially in rural area and in small cities. So for those who don't know their health conditions very well, or they haven't started taking the drug, let's take them aside. Let's talk about those who are already taking drugs. If they withdraw the drugs suddenly, what reaction will they have, Dr. Freda?
Well, depending on the medication, there could be very serious reactions for having withdrawn the medication. So the advice that we generally give is to not stop your medication unless you've had that conversation with your physician. So remember, there are a couple of types of non-adherence. Not taking the medication properly, we talked about that earlier, but also deciding to just stop your medication and not take it again without consulting your physician can be very serious. Not just because the symptoms or risk factors that you're trying to change may not change, right, because you're not taking the medication, but there may be other consequences to stopping. So it's very important to discuss and communicate with your physician regularly about whether or not you're taking your medication, whether you're taking it the way that it's been instructed, and to be sure not to stop unless you've consulted your physician.
Actually, when we imagine that a patient withdraw the drug and discontinue the drug, but he actually experienced the relapse and will it more difficult to treat it? Yes, that's very true. The typical example is that heart disease, atherosclerosis, either enter into MI or the stroke, which lead to hemiplegia. And after the patient suffer from hemiplegia, actually a severe one can be regarded as a death. Actually, 1/3 of the patients die on the road to the hospital. To revitalize the patients is really difficult. In 99% of the times, it's really impossible to save the patient's life. And if you don't take the drugs regularly, and when you suffer from stroke or MI, then it's even more difficult to treat it, and it's really difficult to enable a patient suffer from a hemiplegia to be able to work again, and it's even more trouble to do heart transplant. So you have to maintain the cholesterol level and blood pressure level. Then you can reduce the risk to the maximum. Reduce the risk to the minimum. And just now you gave us an example about the hypertension. You compared the Western Europe and China. But if we only take a look at the heart disease or cardiovascular disease, the adherence level compared with Western countries to China, what's the difference? Actually, there's a huge difference. For example, in China, in the past 5 years study, and we found that in China, we did a lot of surveys and studies. For example, 5 years ago, Australia's George Research cooperated with China to do it, and they observed the platelet and the other risk factors, and the compliance rate is only 60%. As for the stroke in Shanghai, they did another survey, and 1 year after discharge from the hospital, the regular drug intake for the anticoagulation and anti-stroke only 30% to 50% and 60%. Actually, we hope the percentage can reach 80% in the big hospitals after discharge from the hospital. That's what we worry about the most. 1 year or half year, especially above 1 year after discharge, the discontinuation of the drug is a very severe problem. 4 years ago in Europe, a survey result was published. China and other developed and developing countries, the aspirin and anti-stroke and cholesterol-lowering medicine intake in community hospital level, and those who need to take statin or cholesterol-lowering medicine, 90% of them don't take the drugs. That's really extreme case, and they actually did a nationwide survey, which include China. In China, this percentage is 10%, and in developed country, that's 60%. Dr. Freda, could you talk about the situation in U.S.? What's the data in U.S. so we can have a straightforward comparison between the countries?
Well, there are a number of things. I think Professor Maud explained some of the differences. We've been doing a lot of work in the United States, however, to try and improve compliance and adherence. And let me talk about some of the important programs that we've instituted. Some of them are focused on physicians, what doctors can do to make it better for patients to adhere. The other part is what patients can do to themselves work with their physicians to have better adherence, especially in the areas of cardiovascular disease. So the CDC has put out recommendations and tried to make it simple for people to follow, for physicians to follow. And so they used an abbreviation, SIMPLE, S-I-M-P-L-E. So the S is for simplify. And what this guidance suggests is that physicians try and simplify the medication regimen so that patients can do a better job of adhering to them. And that may have, an example might be, a patient should take their medication once a day. At night, they brush their teeth about the same time in the same place. And so what you might ask a patient to do is then to take their medication at night when they're brushing their teeth, put their medication there so that they won't forget. So simplify. The second is I, for inform and give knowledge. And the inform part becomes very important because many times physicians forget or don't give complete instructions to patients. And so this recommendation suggests that you give complete information both verbally and to write it down. And if you have a chance, to also share that information with caregivers and perhaps with the patient's family if they're there. The next is M, which is to modify beliefs and behaviors. And Professor Ma spoke of this, which is patients may have a certain belief about medications or about their illness. And so they may say, you know, I only do have to take this if I have symptoms. It's an opportunity for the doctor to tell the patient, no, this is why it's important for you to take the medicine every day as instructed. And without it, this is how things may progress for you. And to offer them opportunities to think about how to reward themselves for when they're taking the medication on time. The next is around P, right, which is to provide communication and trust. So it's SIMP to provide communication and trust. And this is, again, taking an opportunity to not just tell a patient take it, but to communicate with them and share information as to why this is important. The next is leave the bias. In many cases, physicians aren't perfect. Sometimes we are biased. We think, well, maybe a patient will think this about a medication, or maybe they'll think that. This suggests to physicians that it's important to listen and to not assume anything about patients and what they may think about the medication that you're giving them. And then last but not least is E, and that's for evaluate and monitor. It is very important to not just give patients medication expecting that they'll adhere when we know so much information that they may not. So this evaluate is to be sure that as patients come in, you're asking them, how are you doing? Are you taking the medication as prescribed? And to also monitor their refills to figure out whether or not they're actually taking the medication, all of it in the time that you would expect them to. So if you do all of these things, the S, the I, the M, the P, the L, and the E, then physicians have a better chance of having their patients be adherent to the medication.
Dr. Freda.
Freda gave us a really straightforward explanation, and now we have a better understanding about how U.S. Help the patients to improve their compliance or adherence. You know, in China, it's not that we discontinue the drug use. Sometimes the patients are just forgetful. And in China, we know that the medical system is improving in the cities. Our problem is that the adherence level among the middle-aged and the elderly are very good. The severe their symptoms, the higher the compliance level. For the ordinary symptoms, so without the stroke, without MI, especially the hypertension patients, sometimes they are forgetful. I think the knowledge impartment is very important. If their awareness is not sufficient, if their information access is not sufficient, they don't think their hypertension is a problem. Their blood pressure is 180, 200. They don't think it's a big problem. And I think a very big step is that they start taking drugs, and without MI and stroke, how can we persuade them to lower the cholesterol level? It's even more difficult. Some people think the drugs are toxic and it's toxic to the liver. And just now, the Freda mentioned the I impart information, impart knowledge. That's very important. In China and abroad, it's the same. We need to simplify the regimen. And in the U.S., it's called the simple servant. And among the 7 principles, if you can do it very well, then you can reduce the risks. Among the 7 principles, the diet, pressure, lipid, and also the and also smoke and alcohol intake, those are very important. For those who suffer from hypertension and high cholesterol level, you need to take drugs. Our problem is that nowadays, for those who suffer from minor symptoms, mild symptoms, they are unwilling to take drugs.
So I think on the one hand, media organizations need to do more educational work and also other educational work. In fact, for the patients, they need to correctly understand their own healthy status and the disease. Moreover, if that's also associated with health insurance reimbursement, if your healthy status is also associated with your work performance and promotion, then people will be more incentivized. But now we need to send a message that taking medicine has more benefits than risks. Yes. Then do you have any good advice so that patients with minor illnesses should also be serious about physicians' advice, Dr. Freda?
Yes, I think it's really important. I talked a lot about what I thought physicians could do to have their patients understand more. But there are things that patients can do to understand more for themselves so that they can take control of their health and to have all the good reasons for adherence. So let's take cholesterol, for example. And you're screened for cholesterol, you find that your cholesterol is high, and you need to find a way to control it. What should patients do? They should ask a lot of questions. What does this report mean for me? Do I have other risk factors? If I'm overweight and should lose weight, how much weight should I lose? How low should my cholesterol be? What goal should I be working towards? Should I do exercise? And if I should do exercise, what type should I do? What might be best for me? Do I have any restrictions for the kind of exercise? What about my diet? Here's what I usually eat every day. Should I change that in any way? And if so, in what way? Do I have any other risk factors, like smoking? And if I do, what can I do to change that? So patients have an opportunity to ask questions so that they really understand their health condition as well, and they then have the power to make the changes that they're required. And in many cases, we find that when patients educate themselves in this way, they become more adherent because they understand the importance of we use the cholesterol example, of getting their cholesterol in line. But all of these other factors that they now know they could have control of, and they're asking questions about, they often become more motivated to be adherent to their medicines as well.
Yes. Then for physicians, maybe physicians can still do better. For example, in China, should physicians give more and even more accurate and precise information to patients about how to take medicine? Because for me, I'm not a physician. For example, I'm just a patient. But patients differ from each other. Some patients have minor illnesses, some are serious. For a high blood pressure or high cholesterol patients, physicians, in fact, see such patients every day. So sometimes maybe physicians will also neglect. Yes, you are right, and that's also quite an issue. So for the physician and the patient, they need to have a good relationship. In China, our patients still are not well informed. But some patients, in fact, are very sensible. and they will also try to get more health knowledge by themselves. So health literacy, I think, is not only supported by physicians. Health literacy for our people is a systematic project and is also indicative of a country's cultural and social development status. For example, if someone has a high blood pressure, he needs to take a medicine for the rest of his time. That should be the rule, and that should be a kind of a common sense, a conventional wisdom, just the same as the conventional wisdom that you should protect yourself from fire, etc. So I think for physicians, yes, physicians can still do a better job. Physicians, when they see a high blood pressure patient, and should remind the patient of the importance of a medication. But yes, I know in China, a physician needs to see many patients, and therefore he could only see one patient for a couple of minutes. But even so, the physician could still spend some time asking the high blood pressure patients to take medicine. Otherwise, it will be very dangerous. So that's what a physician could do now. But still, we also need to change something like the whole system. For the minor high blood pressure or cholesterol level cases, they could be managed at the community level. But now China's top physicians are all in the big hospitals. In fact, if we can empower the community health care clinics, they will be better. I acknowledge physicians also are not doing enough in terms of ensuring adherence. And the physician will only ask, do you know you need to take a medicine? The patient says, yes. Okay, then you can go. But then how about the American physicians?
I think American physicians are working hard to do many of the things that we just talked about. But I think in the U.S. and in China and around the world, we have an opportunity around cardiovascular disease in particular, but around many other diseases as well, for all of us to take part. So the community health organizations have an opportunity to more aggressively screen patients and to monitor their health and to get them engaged in taking good care of themselves. Patients have an opportunity to learn more about the risk factors and to do the things that are important to manage their health. The physician that's actually caring for a patient who may have a serious illness or who may have one of the risk factors has an opportunity to do all the things we just mentioned, educating, monitoring, working to make sure that they're informed and knowledgeable. And organizations like Xinhua Net have an opportunity to make sure that we take every opportunity to educate people about how important it is to understand their health conditions, to understand what preventive measures and measures to manage their diseases they can have, and that they become adherent to that advice that's provided to them. So I think we all have a chance to make this a better opportunity for patients to understand and adhere and to have much better outcomes.
Yes. Lastly, yes, Dr. Frieda and also Professor Ma, still we have to, for adherence, what are the most important milestones? Or what are the most important timings? We have said that, yes, patients also need to have a health literacy and should have a self-consciousness of prevention and management. Maybe you can offer some tips about key milestones?
There are a few points that I think patients have the best opportunity to learn, understand, and become adherent. When they're first diagnosed with an illness is a very important time, because that's the time when patients can really get engaged and understand these are the things that you can do, and we're going to work to help you to manage your disease or to reduce your risk factor the best we can. The other is after there's been a serious illness and event. What Professor Ma mentioned, and I mentioned before, is that many times in the hospital or when a patient is very ill, they're adherent to the medicine. And then when they get home and they have those choices to make themselves, well, okay, then it becomes different. Now I might forget, and I'm back with my busy day, and maybe I don't have I'm trying to save myself a trip to go and get my prescription refilled. So these are all things that wane after someone has had a serious illness and may not be in the hospital now. That's another opportunity to make sure that patients and their families understand what they can do. And when I was mentioning that there's so much that all of us can do, I didn't mention what pharmaceutical companies can do. And one of the things that we do is to research ways to make it more convenient to take medication. So to do the research to develop once daily long-acting medications so that patients don't have to remember so many pills and take it so often. Or we can do packaging that's novel, that makes it so that patients can remember whether they took their medicine or not and reduce the chance for errors. Or a recent example was to package 28 tablets in one so that there weren't as frequent visits for refill. So again, we all have a part to play, and we can contribute to making it easier for patients to adhere to their medicines.
Okay. 我们也一样，像刚 Freda 医生。
Yes, as Dr. Freda has said, we can do more. Different people can also play a role. Most importantly, I think, yes, it's a systematic project. And so different players, including different links in the value chain, all can do something to improve adherence. I think the same in the US and in China. People all want to be healthy. And so today, you should take medicine appropriately, and you should follow the physician's advice. If a drug is indispensable to you, you cannot shy away from it. In the long run, it has much more benefit than risk. So, as Dr. Freda has said, yes, we need to recognize adherence is a systemic project involving different people, including educators and media organizations, in addition to physicians and the patients themselves. So we should ask everybody to play a role to maximize adherence. Yes, we are very grateful to our two guests, one from China, one from the United States, talking about the importance of adherence. You also have given a lot of data, a lot of stories and examples. You also have offered a China-American comparison. I think I can summarize. That's just take medicine appropriately or follow the physician's advice. If you can do it, then your risk profile will go down and you can benefit more from your medicine. And there are more benefits vis-a-vis risks. So I hope for our audience, if you have some risk factors or unfortunately you have a certain CVD, then definitely please try to improve adherence for your own benefits. That's the close of our interview. Many thanks to Professor Ma and Dr. Freda. Thank you. Bye-bye.
Okay, thank you.
All right.
All right.
Thank you. Woo. Oops. All right.